So thank you, everybody. Welcome to this STOA event on long COVID, current realities, future directions that I'm very pleased to organize, also together with my colleague Nicolás González Casares. And first of all, I want to thank the team of STOA for the work done during the past months, and also to the speakers, the high-level speakers that we have today, in order to talk about this very pressing issue. I introduce myself. I am Laura Ballarín Cereza, member of European Parliament from Spain, from the S&D Group, and I have proposed this event as I have been exposed through a very close friend to the real impact that this silent condition has on many Europeans. For many of us, COVID pandemic passed during some months. We had back to the real and the normal life. But for many citizens in the world, and especially in Europe, the numbers are around 36 million are affected by long COVID. And we are not talking about fatigue, we are not talking about losing smell or brain fog, and for many of them, severely quality of life diminished. Also losing jobs, losing friends, and in some cases losing families. So first of all, I want to devote this event to the patients. Many of them are watching us because they cannot be here. So I want to send a message to DIDAC and to all the DIDACs of Europe that are watching us. So a big applause to them. So my aim today was bringing big about this topic, and especially sending a message of hope to these patients, that they are not alone, we are with them, they are not invisible, we see them. And especially from the European institutions, we need to take action. As a society, we need to take measures, and especially I call the European Union to take a European Union act. So I would like to take the opportunity of this event to discuss with you, and I really hope that basically we can send hope and we can send future to those millions of people that today we want to give them voice through all of us. That's it. Then I will introduce the technicalities. This event has been organized by the European Parliament's Panel for the Future of Science and Technology. I want to thank also the MEPs that are present, Vice President López, and to all the attendees here. And basically, we want to provide independent expert assessment of scientific and technological options in various sectors, including science sector, one in which Europe is a global leader. STOA has been successfully undertaking this work for nearly 30 years with the aim of bridging the gap between the scientific community and policymakers, which is really important, as well as assessing the impact of scientific developments and new technologies. STOA helps us seeing over the political horizon. It equips us to turn scientific knowledge into policy action, precisely what we need today when we are confronting long COVID. This is achieved by a diverse range of studies and other publications, and by information and dialogue events like today. Let me briefly remind you the basic rules governing this event. This event is web streamed and recorded, as I already said. The web stream link is also available in our publications. The event is only in English. I am sorry we don't have interpretation. And lastly, I am aware that we have a very tight schedule with a lot of speakers, so I appreciate if we can really stick to the time. Finally, I would like to introduce some remarks before the first keynote speaker. So today, workshops intends to offer an appropriate follow-up to the previous initiatives by the European Parliament on COVID-19 and long. Of course, it's not the first event, but I hope it won't be neither the last one. I consider very important to have this conversation today, as long COVID is not high enough on the agenda in the current political debates at the European or national level. This condition deserves greater attention, as it is a significant public health concern. Let us be reminded that according to the WHO organization, approximately 6 in every 100 people who have COVID-19 developed post-COVID COVID-19 condition, so 6% of the population. Long COVID can significantly affect an individual's quality of life, making it almost impossible to perform daily activities, work, or engage in social activities. This is not just, as we said, about fatigue. We are talking nurses that cannot return to their works, or entrepreneurs who have to close their shops because they cannot work the full day. So it's about citizens who feel abandoned by a system that has yet to provide an appropriate response. But its impact is also felt at economic level. The economic implications of long-COVID cannot be ignored, neither, translating into significant losses of productivity, increased healthcare costs, and strain on social services. Bringing a diverse set of stakeholders to the table is the only way to have a better understanding of this multifaceted condition. Only by engaging in high-level debates such as today's and joining forces, we'll find the best ways for healthcare systems to prepare and adapt their responses. Some of the main challenges we are facing today to better respond to long COVID in the European Union are, first of all, the lack of a unified definition of long COVID across the member states. Secondly, the absence of a validated biomarker or objective diagnostic test for long COVID in routine clinical use yet. And thirdly, the presence of national register only them. To tackle these challenges we are facing and to ensure that we maximize all the tools at our disposal to fight this condition, to avoid duplications, to avoid gaps, I would like against the long COVID. We need a plan with clear goals, clear actions and adequate resources. Lastly, but not surely less important, continuing to raise awareness about long COVID helps to promote social acceptance and encourage affected people to seek medical attention, support, and also to work towards more flexible work method schemes, which can allow them to continue engaging with their jobs as much as possible according to their condition. Today's conversation is not only about exchanging views on how, so thank you so much, and I'm really honored to open this discussion. Now I will introduce the keynote speaker of our event, Professor Evelina Tacconelli. Please, if you can come.
Going down.
Professor Tacconelli is Professor of Infectious Diseases and Director of the Infectious Diseases Division of the University of Verona. She is a coordinator of many national and international projects and scientific working groups, among which I would like to mention the European Clinical Research Alliance on Infectious Diseases, ECRIDE, and the Cohort Coordination Board organized by the European Commission to support research in the field of pandemic risk infectious diseases. Her intervention will introduce us to the topic of today's debate by offering an overview on advances, open questions, and patient-centered perspectives on long COVID. Professor Tacconelli is yours. Thank you so much.
So good afternoon. Thanks so much for the kind introduction and the European Parliament for this invitation. This is my declaration of interest with the list of no-profit organizations financing the research of my teams in Italy and Germany. A few introductory notes. Due to time constraint, I'm obliged to make a selection of topics. This selection has been based on my clinical background and on a patient-centered approach. I will cover five different areas. First of all, assessment of critical gaps of European response, scientific evidence, patients and clinician perspective, clinical studies, and I will conclude trying to link the European response to long COVID to the new European pandemic preparedness plan. We'll get you direct access to the cited material. It's very clear that we all agree that this meeting matters. Matters because